Verminous bronchitis. The nematode Dipterococcus viviparus is the only lungworm of cattle. The disease it causes has many local names including parasitic bronchitis, verminous pneumonia, verminous bronchitis, husk or hose. Bovine lungworm has a very wide distribution throughout the temperate and cold areas, and depending upon the climatic condition and season, it can cause serious losses. Coming to the life cycle of the worm, the adult lungworm live in the trachea and bronchi. The females are prolific egg producers. The eggs are coughed up and swallowed, which hatch along the air passages or alimentary canal, and larvae are passed in the feces. These develop in the dung pad through to the infective third stage, which is protected by the cuticles retained from both first and second molds. Because of the ensheathed larvae, the worm cannot feed, and the energy is provided by the stored glycogen granules which is present in their intestinal cells. Moisture is essential for the survival and development of this larvae, and a moderate temperature of 18 to 21 degree permits their full development into the infective stage, and this takes about 3 to 7 days. Larvae survive best in cool, damp surroundings and has the property to overwinter. Transmission occurs when cattle ingest this third stage larvae while grazing. These migrate through the intestinal wall to reach the mesenteric lymph nodes. From there, they pass via lymphatics to the venous bloodstream and through the heart to the lungs, where they break into the alveoli. They migrate up to the bronchioles to the predilection site in the larger air passages and start laying eggs in some 3 to 4 weeks after infestation. Most adult worms soon succumb to the immune expulsion within a few weeks. Coming to the epidemiology of the disease, bovine parasitic bronchitis is a sporadic and largely unpredictable disease. This is because immunity develops much more quick than that of other nematode infections of bovines. Clinical outbreaks occur when weather patterns, management, or other factors result in sudden exposure to a pasture challenge sufficient to overwhelm any immunity that has already been developed. In comparison with the gastrointestinal nematodes of cattle, relatively few worms, that is about a few hundred or thousand, only are required to produce clinical signs. Thus, disease is almost entirely confined to the grazing cattle, and of course mostly in young animals, and that too in the first year on the grass. Infective Dipterococcus viviparus larvae are relatively inactive and are not capable of traveling more than 5 centimeters from the dung pad. Factors that disperse the larvae more widely over pasture include mechanical spreads involving rain, earthworms, wheeled vehicle, or human or animal feet. One curious thing is that the fungus Pilobolus plays particularly important role in the process of transfer of the larvae, and this can occur along the field boundaries. Fungal spores on grass pass through the grazing animals and germinate in the feces. Dipterococcus larvae climb onto the sporangium or the fruiting body, which gets filled with water, and it bursts. And this bursting action propels the fungal spore along with the lungworm or larvae, and this can happen for distance as long as 3 meters. When we think of the immunity to reinfection, this occurs after an initial exposure to the worm, and it happens in variable degree and duration. It normally provides protection during the first grazing season, and it is boosted by exposure to overwinter larvae that are at the beginning of the subsequent grazing season. And cattle removed from infected pasture for long periods can suffer clinical disease when they are re-exposed. Recently, the number of outbreaks of parasitic bronchitis in yearling and adult cattle in some countries are increasing. This reason could be decline in the use of vaccination that has been traditionally followed as a method of control, changes in the weather patterns and management systems, or because of the highly effective anthelmintic strategies, the calves are not able to produce an immune response or an immunologic memory against the larvae, and that may prevent adequate antigenic exposure. Coming to the pathogenesis of the of this disease. The migrating Dictyocolous viviparous provoke little or no damage until they reach the lungs. Thereafter, the passage of larvae up to bronchiole causes them to become blocked by mucus, eosinophils, or other inflammatory cells, and this can cause to the collapse of the alveoli that they supply. Coughing and dyspnea occur if sufficiently large volume of lung tissue is affected. This is accompanied by pulmonary edema and interstitial emphysema. As no structural damage has yet occurred, treatment at this stage in the disease can produce immediate clinical response. Later, however, when mature parasites are in the major bronchi, eggs and fragments of the worms that are killed by immunity are aspirated, and that can provoke a foreign body pneumonia. Secondary bacterial infections may establish at this stage, and sequelae such as bronchiectasis can occur. Such lesions are slow to resolve, but treatment may be successful provided you give a prolonged recovery period. Later still, what happens is that because of unknown pathogenic factors, the alveolar linings of about 25% of recovering animals become cuboidal and they become non-functional. And this can cause a grave prognosis, and such a reaction is irreversible, and many of these affected animals may die. Response of the lung varies widely depending upon the number of larvae ingested, the nutritional status of the host, and whether or not it is exposed to lungworm infection for the first time. Vaccinated animals or those who have recovered from a clinical or subclinical infection may cough and become tachypneic if they are grazed on contaminated pasture, and this is known as a reinfection syndrome. And it occurs as many larvae reach the lungs before succumbing to the immune response, and exposure of older previously infected animals to massive challenge may result in a fatal hypersensitivity reaction. If we look into the clinical findings of an animal suffering from verminous bronchitis, we can see that the outbreaks are in severity from sporadic coughs or no apparent production loss to acute cases with a rapidly fatal outcome. Individuals within a group are usually affected to varying degrees. Poorly nourished animals appear less able to withstand the lungworm infection, and it is not unusual for severe infection to be fatal in well-fed cows. Acute cases have rapid, shallow abdominal breathing of sudden onset and frequent bronchial cough, a slight nasal discharge, and a temperature of 104 to 105 degree Fahrenheit, and a heart rate of 100 to 120 beats per minute. The animal may be bright and active and will attempt to eat, although respiratory distress often prevents this. The progress of disease is rapid, and within 24 hours, dyspnea may become very severe, accompanied by open mouth breathing, and the head and the neck becomes outstretched with a violent respiratory heave and grunt. Cyanosis happens and ultimately become recumbent and may die. On auscultation, lung consolidation is evidenced by loud breath sounds, crackles, and are heard over the entire bronchial tree. The crackling of interstitial emphysema commences over the dorsal 2/3 of lung, but is never as evident as in less acute cases. Fever persists until or just before death, which usually occurs in 3 to 14 days, and is greatly hastened by exercise or excitement. Case fatality rate of this form of disease is high, probably in the order of 75 to 80%. Subacute disease. Subacute disease is more common in calves than the very acute form. The onset is usually sudden, the temperature is normal or slightly elevated, and there is increased rate and depth of respiration. An expiratory grunt is heard in severe cases, and expiration may be relatively prolonged. The frequent paroxysm of coughing is another peculiarity of this form of disease, and the course of disease is longer, and it may take about 3 to 4 weeks to resolve. And auscultation findings may vary with the duration of illness and the area of lung involved. In general, there is consolidation and bronchitis ventrally and marked emphysema dorsally. The affected animal lose weight very quickly and are very susceptible to secondary bacterial pneumonia. Mortality rate is much less than the acute form, but many surviving calves have severely damaged lungs. Consequently, they may remain stranded for long periods and breathing may be labored for several weeks. Some surviving calves may show a sudden exacerbation of dyspnea around 7 to 8 weeks after the initial onset of disease. In these relapse cases, prognosis is grave. Adult dairy cattle are usually immune, but sporadic outbreaks do occur as a result of waning immunity, and mortality and morbidity can be high with reduced milk yield and significant economic loss. There will be cough, and sudden exposure of immune adults to massive challenge can cause interstitial pneumonia. Necropsy findings. Adult Dictyocolous viviparous are up to 8 cm long and are easily seen when the trachea and bronchi are cut open. Worms may also be recovered during lung perfusion. Up to several thousands may be present and in severely affected animals. In prepatent disease, however, careful microscopic examination of the bronchial mucus is necessary to find the larvae. Adult worms may be few or absent if the case is of sufficient duration or because of the immune expulsion that will expel the worms that are present in the lungs. In acute cases, morphological changes include enlarged lungs as a result of pulmonary edema and emphysema, widespread area of collapsed tissue of dark pink color, hemorrhagic bronchitis, enlarged regional lymph nodes, and histologically there will be edema, eosinophilic infiltration, dilatation of lymphatics. The alveoli and bronchi may be filled with inflammatory debris, and larvae may be present in the bronchioles and alveoli. In subacute cases, interstitial emphysema is usually gross, and there will be areas of pink consolidation, and the diaphragmatic lobe may also be involved. They can occupy about 2/3 of lung volume. There is froth in the bronchi and trachea. The regional lymph nodes are enlarged histologically. The ova or the larvae can be seen in the air passages. Bronchial epithelium will be much thickened, and bronchioles and are found to be obstructed with exudate, and the alveoli show epithelialization and foreign body giant cell reaction because of the aspirations and the presence of worms. The presence of Dictyocolous viviparous larvae in the feces confirms the lungworm infestation, but their absence does not necessarily exclude the possibility of parasitic bronchitis. No larvae will be passed in the early stages of the disease when causal worms are still immature, nor will they be a constant finding when partially immune animals succumb to the challenge. In general, larvae can be found about 12 days after signs appear, and they are few in number, but at first but may become numerous later. Enzyme-linked immunoassay test or ELISA test using adult larval worm antigen for the detection of the specific antibodies against the worm has been standardized in for serum and for bulk tank milk. And a care is required in interpretation of the result, because antibodies to the adult antigen may not be detectable until several weeks after the primary challenge, and it does not correlate with the immune status of the animal. Eosinophilia is a fairly constant finding, but it's not pathognomonic. An alternative method is if a disease is suspected but the lungs worms are still in the prepatent stage, the idea is to examine the pasture clippings for larvae. But this is a very laborious process, because a large amount of herbage, for about 1 kg of herbage has to be used, and the yield of larvae will be much less. Dictyocolous viviparous larvae may be demonstrated by placing feces on a fine sieve or a dental gauze on the top of a water-filled funnel, and the technique is called Behrman technique. The larvae that swim to the water and collect at the bottom of the funnel are less than 0.5 millimeter long, sluggish, and often appear curved and coiled. Their most important diagnostic feature is the presence of easily visible refractile granules, which are stored glycogen granules in their intestinal cells. Not all animals will be shedding the larvae. Samples should be taken from all or at least a representative proportion of the group. The parasite is susceptible to all modern anthelmintics like eprinomectin, ivermectin, doramectin, albendazole, or other benzimidazole, febendazole, fenbendazole, or netobimin, and levamisole. The dosages are given in your printed notes. Extended release formulation of eprinomectin or long acting formulation of ivermectin has been used for control of the organism. Vaccination is done using a live irradiated D. viviparous larvae, and there will be the dosage is about 1000 larvae per calf and is given orally. That we will come to we will discuss later in the session. Coming to the control, two major strategies of control has been applied. This derives from the premises that the main factor governing the occurrence of the disease is the density of D. viviparous larvae in the pasture grazed by susceptible cattle. First, cattle grazing potentially contaminated pasture can be protected by vaccination or anthelmintic cover. Alternately, steps can be taken to ensure that the pastures are safe for grazing. This is usually achieved by prophylactic anthelmintic programs. But delaying spring turnout till overwintered larvae dies away is a theoretical option in case of organic farms. Sensible grazing management is important in all systems but cannot be relied upon per se for controlling parasitic bronchitis in view of the unpredictable nature of the disease. Although natural immunity provides adequate protection in many farms, this cannot be accurately measured or predetermined. With the possible exception of the beef suckler systems, calves should not be run in with the adult or older cattle because they may be harboring asymptomatic patent infections that can contaminate the pasture. An important consideration is that clean pasture can be contaminated by larvae from neighboring fields that are carried on by windborne fungal spores. Although the numbers of larvae spread in this way may be very small, but they can initiate an epidemiological cycle that culminates in disease after some weeks. Coming to vaccination, vaccination of cows with 2 doses of 1000 infective larvae attenuated by irradiation. Keep in mind that this is an attenuated vaccine. That means even after irradiation, the larvae will be live, and it is a long established and effective control method for preventing the disease. Only healthy cows should be vaccinated, and they should be at least 8 weeks old. The vaccine is given 6 and 4 weeks before turning out into the pasture. Exposure to lightly contaminated pasture will boost immunity, but low-grade patent infections may develop in some animals. Vaccinated and non-vaccinated animals should not be grazed together because the former may contaminate the pasture, enabling lungworm cycle through the susceptible animals. Vaccine gives high level of protection under most conditions, but vaccinated cows should not be put into a heavily contaminated pasture. Coughing may occur when immune response kill the lungworm larvae in the lungs when they are in the pasture. Overt disease can occur in cases where there is an overwhelming challenge, and to avoid such problems on severely affected farms, vaccinated cows should be allowed only a gradual access to pasture. Experimental recombinant subunit vaccine based on the parasites paramycin as a recombinant antigen that overcomes the disadvantages of attenuated vaccine has been developed. Strategic anthelmintic programs provide an alternative to vaccination. The aim is to suppress the infection initiated by overwintered larvae and thereby prevent subsequent contamination of pasture. This can be done by application of a suitable intraruminal bolus at or just before spring turnout or by giving 2 or 3 doses of ivermectin or milbemycin during early grazing season. These systems are designed to control parasitic gastroenteritis and lungworm. Clinical field experiments have demonstrated good result with ivermectin, fenbendazole, and oxpendazole boluses with ivermectin, where ivermectin treatment is done at 3, 8, and 13 week after turnout, or doramectin administered at turnout and then again 8 weeks later. Cows may become vulnerable after a period of anthelmintic cover if pasture contamination occurs. In places where there is a very long grazing season, an extra cover of anthelmintic treatment can be done. Cows that are exposed to infection but protected by chemoprophylaxis during first grazing season generally have substantial resistance to infection in the second year. Nevertheless, field experiments have shown that immunity can be compromised to a degree related to the level of protection provided. There is concern that such intensive treatment may provoke anthelmintic resistance, but no strains of Dictyococcus viviparus with resistance to anthelmintics have never been reported yet. So that finishes the chapter on verminous bronchitis. Thank you.